Hi everybody, welcome back to our channel. Welcome back or welcome to Mo Talks. M for Moira, O for Finza Talks, because we talk about everything and anything under the sun.
It's Wednesday. Welcome back to Wednesday with us. As for Wednesday thing, we have decided to move more talks from Tuesday to Wednesday. We've been re-looking at our channel and re-changing a few things, or you reshuffling a few things, So that's why we've been a bit quiet. We want to bring back our devotion, which was happening on Mondays at some point. I don't even remember, but then we want to bring that back into our channel. So that will be Monday would be for devotion, and Wednesday would be for more talks, and Friday you chilling with us as a family, or depending on what's going on, whether it's us or all of us or not all, but it's Friday we just chilling, honestly. So if you're looking out for more talks, it will no longer be on Tuesdays. It will be on Wednesdays. And check out our devotions, and sometimes it will be just me, and on other days it will be just Ofense, and other days it will be me and Jonathan, until he's able to do it on his own. And on other days it will be all of us as a family devotion time. But that will be on a Monday. All right. So, but today it's more talks. It's Wednesday. We're finishing up on our hygiene topic. We're finishing up on hygiene. We're still on self-care. Soon we're completing this series. Very soon we're completing this series. And so today we're talking about
nails and hands.
I'm going to just leave it to Ufense to talk about hands. Let's it's not a big topic. It's not a very detailed topic. I hope this will be nice and short. So Ufense, let's talk about hands. I mean, this is all about hygiene. Nothing fancy.
So with hands, I think really back to basics. It's hygiene. Wash your hands. There's dirt, you touch things, from food to the floor to clothes to everything. Hands are always touching something. And it carries a lot of germs. So because also you use your hands for a lot of things. You eat with your hands, you rub your eyes with your hands. You touch yourself with your hand. Like your hands they need to be clean 24/7. So after the bathroom, wash your hands. After you've done something, like you've made food, for example, before and after. Before, obviously, it's the hygiene for the food, that your food is clean and edible. And after, because you don't want to carry around messy hands, wash your hands. Keep them clean.
It's as simple as that. Hands hygiene. Really, it's all about making sure that you carry around with you clean hands. It's very true what Ufense is saying. Our hands, they can look clean,
but the germs,
that's the thing with a germ. You don't see it. It's not something you can see unless if you take a microscope
and you check.
Go into it. I don't want to do that. But it's not something you can really just see by looking at my hands like this and say, and sometimes we make a mistake of thinking just because they look clean, they are clean. No, it's just because they look clean, it doesn't mean they are clean. The fact that I've been touching things, like now I've just scratched my scalp, you just touched your hair,
coughing into
exactly,
your hand,
we say exactly,
digging in your ears, up your nose. Some people
we don't dig up our nose.
No, people shouldn't dig up their nose.
Okay. Well, children in this case,
exactly.
They do that,
they're still learning.
When you grow up, you don't dig up your nose. No. But anyway, it's important that we wash our hands, that we don't spread germs. For ourselves, you're protecting yourself and
other people,
and the other person in the home or wherever you are. So go into the bathroom, like Ofense said. When you go to the bathroom, it's important after you've done what you were doing, take soap and wash your hands. Now, we've just come back from COVID, and it's amazing what COVID-19 did, which I like. The one thing I like about what COVID-19 did is like it highlighted hygiene and made it even more necessary and more important, and than it ever was before. I mean, it's something we knew of it, we did it. Some of us we did it, some of us we neglected it, some of us we could not be bothered. But when COVID-19 hit, it was like, we started, those who were not buying wipes were buying wipes. Those who were not buying sanitizers were buying sanitizers.
If you weren't buying a tissue,
those who were not, no, but we're talking about just hygiene ones. Tissue is something else. But those who were not washing their hands, all of a sudden, tap was your friend. 24/7 you were washing even when you didn't need to wash. And things like that. So that's what I like. That's, for me, that's one of the things, if I had to go back to COVID-19 to say, what is something that you would say COVID-19, what is a good thing that you would say COVID-19 brought, was that hygiene part, and even when things went back to normal, that remained with us. The whole sanitizing thing remained. Wipes, for those who never really thought of wipes, they continued to use them. They didn't stop. For those who never thought of sanitizing, they continued to sanitize. They didn't stop, But what I always say is, sanitizing is not washing your hands. If there's something better than washing your hands is better than sanitizing your hands. Sanitizing, just taking a sanitizer after going to the bathroom, is not washing your hands. So it's very important to wash your hands with soap. Soap kills and remove dirt and germs of our hands and our nails. That's sanitizer does goes a long way. It's got alcohol which kills and everything. But I always tell my children, before you go for that if wash your hands, then you can sanitize. Then you've really done a great job. And all that. And if you are in a position where you cannot wash your hands, you don't have access to the tap, you've got wipes with you. You can really use the wipes to wipe your hands, and your hands are clean, whether it's before you eat or after you've handled the child with snotty nose, because that's a virus, it travels. That's why we wash our hands. If you're handling a child who's got a fever, a fever or a runny nose, or things like that, and you wipe their nose and you don't wash your hands, before you know it, you're experiencing the same symptoms the child is experiencing, because I didn't wash my hands. I went off and ate my sandwich, or I touched my nose, I touched my eyes after handling a child who's got flu. And I'm surprised I'm having the same symptoms. So it goes further than just spreading germs. You also want to protect yourself. So go and wash your hands. If it was not something you like doing, please wash your hands. When you're taking garbage, when you come back, wash your hands. Go into the bathroom, wash your hands. Like she said, after food, wash your hands. There's so many things we can say. After blowing your nose, after wiping a child's nose, wash your hands. After helping the child in the bathroom, wash your hands. After helping yourself in the bathroom, wash your hands. Some of us who like planting, I like planting. I've just finished my video. Go check out Bring Life Indoors. I do have a YouTube channel called Bring Life Indoors. If you like plants indoors and outdoors, that's what I do. Go check it out. But nonetheless, I'll link it on the description below. So if you are like me and you like planting, when you are done, wash your hands, take the brush, wash your nails to remove everything, the dirt and everything out of your nails. But that's that with hands. And
after washing, moisturize. With a cream. Hand cream. Yeah. This is the one Mommy uses.
Anyone. I always say, go for the one you like. I've got dry skin, so I always look for something that really will moisturize my hair, and the moisture will stay. It won't evaporate in minutes. So look for something that works for you, and make sure that you go in there, you you really go in there. Even, you know, on your nail bed, you go in there, your cuticles, you go in there, you know, because just as much as our body needs to be moisturized, so our hands, we need to moisturize
and
our
because
hands.
they stay underwater, because you're forever washing, they get the driest quicker.
Yeah,
so you need to wash them, keep them moist.
Exactly. And you will have nice, supple, soft hands if you are consistent with your hand cream. Trust me, you will. Doesn't matter how much water you touch, you will have nice, supple, soft hands. Make sure that you apply cream when you're done. Make it your friend, you know. And if you can, get one with sunblock in it. And especially when you drive a lot, your hands are exposed to the sun a lot, you know. And if you don't have one with sunblock, that's what I do. After that, I apply a bit of sunblock on my hands, especially when I'm outdoors and I'm driving. Yeah, it will keep your hands looking good. Yeah, and that's it. And one of the things we can mention really when it comes to hands is, you know, that has nothing to do really with hygiene. It's more self-care. It's pushing your cuticles. You know, I've taught my kids to say, you know, you push your cuticles. You can get a tool. You can use a tool like that. You can see it's flat. It's flat, as you can see. It's flat, and you use it to push your cuticles. You can use your fingers, your other hand, your nails to push your other nail bed. Yeah. Then and then after that you take your oil. I usually apply my oil first on my cuticles, and then I push them and I rub it in your cuticle oil. Now, if you don't have a cuticle oil, you can use olive oil. You don't have to go buy cuticle oil. You can really use the olive oil. So basically what you do is you take just a little bit, goes a long way, and you put it on your cuticles like that, and then you rub it nicely like that. Rub it in, you rub it in, you rub it in, you rub it in. When you are done, you take that little stick and you push in your cuticles in, you know, you push them in, and then you rub. And after that, after you've done all your hands, you know, you're done with that. But obviously that will be something you do not daily, but when you see they need to be attended to. But think about it, and you'll have lovely hands. Absolutely lovely hands, even without nail polish. So yeah, that's it from the hand side, I think. Yeah. And yeah, that's it. Is there anything we missed, Francis?
I think in the nail section, it's really just like continue to take care of your nails.
Yeah, take care
of
your nails.
You know, pushing back your cuticles, applying nail oil, cutting your nails.
For those, I mean, if you want to keep short nails, you know, I mean, there's people who like to keep long nails. Don't leave them to chip. Use your files.
File them, shape them, make sure they're still pretty. You know, and decent, and you know that you can.
Exactly.
You
know that I mean, your hand is the first. After they see your face, your hand is the first thing you extend to someone.
Exactly.
You use
the next thing they look at.
You know. So it doesn't always have to have nail polish or
gel
or acrylic or you know. They can look beautiful and presentable naked as they are if you look well after them. You know, those cuticles, pushing those cuticles, filing them, shaping them nicely, and keeping them clean and the length you like. When you feel there's a chip coming, address it before it goes further than what it is, you know. And you'll have beautiful nails and hands in no time. It doesn't actually take long. That's it. But that's it from us for today concerning your hands and nails. We look forward to your comments, isn't it?
Yep.
Yeah. Until next time, have yourself a beautiful day and go take care of your hands and nails. Bye.
Bye.